Possible causes of resistance to cytotoxic chemotherapy include increased repair of DNA damage. Of the following which is unlikely to be associated with drug distribution into and out of the central nervous system? Strongly ionized drug freely enters the CNS through carrier-mediated transport system. Which of the following is unlikely to be associated with oral drug administration of film-coated dosage form? Unpleasant taste of drug. So, identical doses of capsule preparation X and tablet preparation Y of the same drug were compared on a blood concentration time plot with respect to peak concentration, time to peak concentration, and AUC after oral administration as shown in figure below. This comparison was made to determine which of the following, that is bioequivalence. Immunologically mediated reaction to drug observed soon after administration is tachyphylaxis. A rapid reduction in the effect of given dose of drug after only 1 or 2 doses is hyposensitivity. A child shows symptom of high fever and skin eruptions. It is diagnosed as chickenpox. The drug of choice would be acyclovir. Azidothiamidine is the nomenclature for zidovudine. Zalcitabine, zidovudine, efavirenz, and indinavir are drugs recommended during an HIV infection. Which drug does not affect DNA synthesis in HIV? Indinavir. Which one of the following is a prodrug of pencyclovir? Both 6-deoxydiacetyl pencyclovir and famciclovir. Drug of choice for typhoid is ciprofloxacin. The mechanism of action for tetracycline is that they inhibit amino acyl transfer RNA attachment to A site. Tetracycline cause which one of the following side effect? That is Fanconi syndrome. Chloramphenicol is obtained from Streptomyces venezuelae. Dipiveprin is the prodrug of epinephrine. An example of supra-additive combination is acetylcholine and physostigmine. A person is suffering from keratoconjunctivitis caused by herpes simplex virus 1. He is prescribed eye drops of an antiviral drug. The drug is idozuridine. After taking this medicine, the patient may suffer from neutropenia. The baby seems to develop syndrome, that is Gray baby syndrome. The drug causing the above symptoms is chloramphenicol. A broad-spectrum antibiotic when taken causes pseudomembranous enterocolitis due to superinfection. The organism responsible for this condition is Clostridium difficile. The drug of choice for its treatment is metronidazole. Which one of the following groups possesses triazidoimidazole group? Dicarbazine. Biochemical activation of cyclophosphamide produces an active metabolite. This metabolite is phosphoramide mustard. Mesna is given for the toxicity amelioration of cyclophosphamide for cystitis. Active metabolite of spironolactone is canrenone. A person suffering from carcinoma is prescribed a cytotoxic drug which produces neuropathy as the adverse effect. The drug is vincristine. It acts by metaphase arrest. Which of the following is not correct for bromhexine? That is soothes throat directly as well as by saliva. Piclamilast is an inhibitor of phosphodiesterase 4. Which of the following cephalosporin has zwitterion characteristics? That is cefpyrome. Which one of the following antibiotic causes leakage from cell membrane? That is colistin. Which of the following is a polypeptide antibiotic? Tyrotyrosine. Which of the following antibiotic causes discoloration of skin? Clofazimine. Which of the following drugs attacks hypnocytes and thus used in radical cure of malaria? Quinine. An anti-vertigo agent is cinnarizine. A prokinetic drug is ondansetron. The ultra anti-insulin preparation is administered by subcutaneous route. Insulin receptors are tyrosine protein kinase receptors. Mechanism of action of sulfonylurea is provoking insulin release from beta cells. Verapamil exerts its effect by the following mechanism: by blocking L-type calcium channels. This is an example of non-selective phosphodiesterase inhibitor, theophylline. The drug of choice for methicillin-resistant Staphylococcus aureus is vancomycin. Patients having a history of severe immediate reaction to penicillin have a low risk of having reaction to broad-spectrum anti-pseudomonal penicillin. Chloramphenicol is associated with pancytopenia, gray baby syndrome, reversible erythroid suppression of bone marrow, and renal failure. Vancomycin is used for the treatment of Clostridium difficile induced diarrhea. It is useful in treating methicillin resistant staphylococci. It is potentially ototoxic and requires a dosage adjustment when administered to patients with impaired renal function. The drug of choice for Streptococcus pneumonia in patients with no drug allergies is penicillin. Aminoglycosides are excreted renally. These are bactericidal and potentially toxic to the auditory and vestibular portions of the 8th cranial nerve and potentially nephrotoxic. Clindamycin is associated with diarrhea. It is active against anaerobes and active against some gram-positive organisms. Amphotericin B is very useful agent for treating fungal infections. Correct statement regarding amphotericin B includes: it is both hydrophilic and lipophilic. It binds to sterol in the fungal cell membrane. A test dose should be administered before treatment begins, and it may cause nephrotoxicity. Which one of the following antitubercular agent is associated with the development of ototoxicity? That is streptomycin. Which of the following agents used in the treatment of pulmonary tuberculosis has a toxicity of producing a lupus-like syndrome? That is isoniazid. Tubercle bacilli exist in tuberculous patient in 3 pools: extracellular, intracellular, and necrotic caseum. The only drug which is bactericidal for all 3 is isoniazid. All of the following are considered primary drugs in the current therapeutic approaches to the treatment of tuberculosis except para-aminosalicylic acid. Which of the following antitubercular drugs has hyperuricemia as one of its untoward effects? That is pyrazinamide. Which one of the following is a bactericidal antitubercular drug that has an inhibitory action on the cell wall synthesis? That is isoniazid. Ethambutol has become a primary treatment drug in the therapy of tuberculosis because of its infrequent side effects. The only significant toxic effect is retrobulbar neuritis. Hemorrhagic cystitis is associated with cyclophosphamide. Drugs that may cause megaloblastic anemia include each of the following except thiabendazole. Which of the following drug has been used for the treatment of river blindness? Ivermectin. Tetracyclines are not used as first choice drugs in typhoid. Which of the following antitubercular drug is used in the treatment of leprosy? Rifampicin. Reddish black discoloration of skin is the major disadvantage of clofazimine. Gray baby syndrome is the specific adverse effect of chloramphenicol, which occurs in neonates due to blockage of electron transport chain by chloramphenicol. The drug of choice for clinical cure for all types of malaria other than resistance cases is chloroquine. Which of the following antibiotics is closely associated with the development of renal and ototoxicity? Kanamycin. The drug used in all types of TB is isoniazid. Which one of the following antibiotics is most closely associated with the development of ocular toxicity? That is ethambutol. Flu syndrome, respiratory syndrome, abdominal syndrome is the characteristic feature of rifampicin. Which is the drug of choice for scarlet fever? Penicillin. The following drug is not used for the treatment of systemic fungal infection except dermatophytosis, griseofulvin. Following drug is used in the treatment of multi-drug resistant strains of Plasmodium falciparum. Mefloquine. 1 international unit of sodium benzyl penicillin is equal to 0.6 microgram of the standard preparation. Antiviral activity of zidovudine is due to inhibiting viral RNA-dependent DNA polymerase. Red color urine is the common side effect of rifampicin. Which one of the following drug is both penicillinase resistant and effective by oral administration? That is combination of amoxicillin and clavulanic acid. The antiparasitic drug is activated to toxic intermediate by the pyruvate ferredoxine oxidoreductase enzyme system that is present in anaerobes, that is metronidazole. The selective toxicity of vancomycin as an antibiotic is most likely because of its action on biochemical pathway unique to bacteria. Acyclovir is both deoxyguanosine analog and anti-herpes drug. The most effective drug for prophylaxis against meningitis is sulfaoxazole. Which one of these combination is MAO inhibitors? Tranylcypromine, phenalzine and isocarboxazide. Sodium nitroprusside is one of the most potent blood pressure lowering drugs. Its use is limited because of its short duration of action. Digitalis preparation are contraindicated with thiazide diuretics. Choose the correct class 4 drug antiarrhythmic that is primarily indicated for the treatment of supraventricular tachyarrhythmias, diltiazem. Which one of the following drugs, when co-administered with terfenadine, may lead to life-threatening cardiac dysarrhythmia, that is itraconazole. An agent used in Prinzmetal angina has spasmolytic action which increases coronary blood supply is isosorbide mononitrate. The antihypertensive action of captopril is affected by spironolactone. Which one of these is useful in peripheral vascular disease? Isozubsprine. The action of quinidine differs from that of digitalis in decreasing irritability of cardiac muscle. The digitalis action is enhanced by calcium. Tolerance to nitroglycerin may be overcome by temporarily discontinuing the drug for 1 or 2 weeks. Aspirin in small doses is likely to be useful to prevent attacks of pain in typical angina. The drug used in clonidine withdrawal is phenoxybenzamine. Which of the following anti-malaria drug is 4-aminoquinoline derivative? Amodiaquine. The antiarrhythmic drug having no antimuscarinic action is lidocaine. The antihypertensive drug to be avoided in diabetic patient who is taking insulin is propranolol. The following antihypertensive drugs that tends to elevate plasma triglycerides are thiazide diuretics. Coronary still phenomenon is shown by which anti-anginal drug? Dipridamole. Novel anti-anginal drug act by non-hemodynamic mechanism is trimetazidine. Calcium channel blockers which have maximum channel blocking potency and does not suppress SA node.